Tonight, the state of Washington takes unprecedented measures to stop the coronavirus.
Certain events in King, Snohomish, and Pierce County with more than 250 people are prohibited.
We have experts in our studios right now to answer your questions. What should you do?
How worried should you really be? And how long will all this go on?
It's similar to what you might think of as an infectious disease equivalent of a major earthquake that's going to shake us for weeks.
Welcome to this live King 5 News special, Coronavirus, Facts, Not Fear. And good evening. These are tense and even scary times for a lot of us. So tonight, we're answering your questions with the help of experts. Good evening. I'm Joyce Taylor.
And I'm Mark Wright. Thank you for being here tonight. This is all about just taking a deep breath, getting the facts, and then moving forward where we need to. There has been an overwhelming amount of concern and frankly a lot of fear surrounding the coronavirus here in the state of Washington. So over the next 2 hours, we will work to give you the very best information, straight answers to your questions about exactly what's happening.
So joining us tonight, we're going to be talking with state, county, and city leaders, doctors, educators, policy decision makers, and answering some questions, the things that you want to know about the virus.
So if you have questions, you can text them to us right now. King 5's Jessica Janner Castro is going to go through them with one of our experts here in studio tonight. The number to text, 206-448-4545. Send them to us. We'll get to as many of those questions as we can over the next 2 hours right here. But first, there have been several new and significant developments on the virus today.
Some, in fact, in just the last few minutes. So let's get right to Greg Copeland for the very latest. Greg.
Okay, before we get to that, we have the new developments, and we wanted to bring you the latest verified information.
So two major announcements that will impact daily life, one in Washington, D.C. today and one here in our state. Governor Jay Inslee banned public events of more than 250 people in 3 counties. They are Pierce, Snohomish, and King County, where we are also seeing restrictions on smaller events unless organizers take measures to mitigate the risks.
So the ban covers social, recreational, spiritual, even large sporting events. Teams like the Mariners are now looking for new venues for their home games. We're hearing they may play in Arizona. Others are going on with games without fans in the stadium. Grocery stores and restaurants can stay open and will be asked to follow specific guidelines. Some downtown restaurants have already closed as a precaution or simply because their business is so slow.
Seattle Public Schools closed today. Closed until further notice, but at least for 2 weeks. Starting Monday, Everett Public Schools will close as well for a minimum of 14 days. Lake Washington and Shoreline Public Schools are closed until the 27th. Stanwood schools are closed for the rest of the week. North Shore schools, they are not having in-person classes, and there is no blanket order to cancel schools. Enforcement of the ban will largely be by complaint.
But Governor Inslee had a very blunt message today about those not following the rules.
Penalties are you might be killing your granddad if you don't do it. And I'm serious about this. The principal reason this is going to work is for people to understand the consequences of lack of community responsibility.
So this graph shows what Governor Inslee is talking about. Social distancing is believed to drastically reduce the number of cases we could see.
So as for the numbers right now, there are 29 deaths reported in Washington, most of them in King County. Now more than 360 total cases. It's important to note, though, that we're also testing a lot more people, more than 3,400 so far as more tests are being done. Those numbers are expected, of course, to go up.
Well, today the virus was declared a global pandemic. We'll get into just what that means. Sounds kind of scary. It's important to note this. By definition, that just means that this is a new virus with sustained person-to-person contact, and it's spreading in countries all over the world. However, concern about a global spread is responsible for another huge restriction tonight. Just a little bit ago, the president announced a suspension of all air travel from Europe to the U.S. for 30 days, beginning Friday. The United Kingdom, not part of that restriction. There are some other exceptions, and we'll talk about those later. All right, we've got a lot of guests to get to tonight. We're going to learn a ton. Our first two guests include the Secretary of Health for the state of Washington, Dr. John Weisman.
And also here with us tonight, Seattle Mayor Jenny Durkan. To both of you, thanks so much for coming in. We're going to get to viewer questions as well in just a moment, so just hang tight for that. But I want to start with you. We heard in just the last hour from the president a travel ban for folks coming from Europe to the United States. What's your reaction to that?
So I don't have all the data on why they thought that was necessary. We obviously have to do containment. It wouldn't have been the first step based on what I know. I think the number one thing we need this president to do is declare a presidential emergency so that we can get access to FEMA funds in Seattle and across the nation. We're going to need them desperately to do some of the work we need to do. This is as bad as any hurricane, and that's the number one thing I think we would like the president to do. I was able to meet with the vice president. We put in some very specific requests to him as a city and a region, and we're hoping that we get that back from him as well.
I know that you have your finger on the pulse of the business community. The president in his speech tonight talked about $50 billion in small business administration loans, perhaps, that could be used to help small businesses. We're already seeing a huge drop-off in business for a lot of Seattle businesses. What can be done to help them meet payroll? What can be done to mitigate just destruction of them?
So this is a focus of ours, very much so, and of the governor's, and we've looked at a suite of packages because it's not just the large businesses. Our small businesses are really going to struggle, and their employees are going to be out of work. And so we need to make sure that we can, just as in the healthcare system, we have to take care of the most vulnerable. In our economic system, we're really trying to make sure that we can take care of those low-wage workers, some people without sick and leave, and also for those employees. So the governor's giving them more uninsurance, the unemployment time. We're looking at a suite of things for small businesses to help them on a range of things, from everything from suspending their having to pay their B&O taxes, so that they won't have to pay that out of money, and looking at a whole range of things to really help our small businesses.
Dr. Weisman, hang on for just a second, because also within the last few minutes we heard that the NBA is suspending all games, which is going to have a business impact across the country. What do you make of that, suspending games indefinitely?
I think it's a move that I think is very bold. I know the NBA and all the sports people have been looking at what do they do. I think it is clear that while Seattle is the first, and unfortunately we're often the first in this way, in a way we wish we weren't, this virus respects no boundaries. And those cities and regions who are starting to see it, it will increase, and they need to get ahead of this. The actions we took today, the governor took, the county took, and we took, really will help, we think, stop the spread of this virus, which is so critical. And I think that every business in America, every community in America is going to have to make some sacrifices. This is going to be a long haul. I think we can get through it, but there's some tough roads ahead for Seattle. But everyone pulling together, I think we can get through it and be stronger at the end.
Things are changing even as we speak. Just in the time that we've been on the air, we have just heard that the Seattle Archdiocese has now canceled all Catholic masses in this area, and also a staffer for Senator Cantwell's office has tested positive for coronavirus. So lots of new developments. I want to get to you, Dr. Weisman, Secretary of Health for the state of Washington. It seems like our country may have been caught flat-footed on this. We knew months ago this was going to be a problem. Give me your assessment about how we've responded so far.
Yeah, well, thank you. Well, first of all, I would say that we know this is a very serious public health threat. We've known that from the very beginning, and we've been planning for that and prepared. The thing that I think is important for the public to understand is really this is spread primarily through droplet spread. And so you want to be covering your coughs, and you want to be staying home if you're ill, and not touching your face, unless you've washed your hands. So we each have a responsibility here in terms of this response, in terms of our own personal efforts, as well as the efforts that the governor and that our regional leaders took today to banning these large public gatherings to reduce and increase our social distancing from each other. So while this is a new virus, this is not a new response. While we don't have a drug to treat this at the moment and we don't have a vaccine, we do know what to do. And we need everybody working together, caring for each other, to actually see us through this, and I'm confident that we will get through this.
Dr. Jeff Duchin today with the Seattle-King County Health Officer, he's the Chief Health Officer, was talking about a UW study that said by April 4th, with the projections that they looked at, we could see 25,000 cases here. by then. So what would our city look like? What would healthcare look like? How would we address that if we have 25,000 cases of coronavirus?
Well, that's exactly why we've taken the action that we've taken today, is we want to do our best to prevent that and not achieve that level of 25,000 cases. And with that is potentially over time 400 deaths. With that. And this piece of increasing social distance, what we're trying to do is slow the spread of this. So the chart that was shown says if we didn't do anything today, that's what we might see in our future. That's why bold action now and decisive action by our leaders is so incredibly important.
And Joyce, I might just add on that. I think what got lost is that's as of that date, but right now, if we don't do anything, it doubles about every week. And
Right.
so the numbers here are astonishing, and that's why I think it was so important for people to see levels, all government together saying, we've got to act with one voice and one government.
Luckily, we have 2 hours to take questions, and we want to get to one right now. This is from a viewer, so let's listen to this.
Hi, I'm Ann from Seattle, and I just want to know where this virus came from and what they're going to do about it and stuff like that. I'm just wondering, that's my question, where it came from. Well, obviously we know where it came from, but how did it get to Seattle of all places?
So, Dr. Weissman, this is a common theme. We've seen this with MERS and SARS and swine flu. Take us back, and why does everything seem to start in China?
Well, we know that viruses sometimes pass from animals to humans, and that's exactly what we think happened here. And as we live in more crowded conditions and as we live closer or engage with animals, this is something that happens. And, flus, for example, sometimes happen this way. Travel and the sort of amount of our global travel and just the movement of people really allows for viruses like this to spread pretty quickly, which is why sort of good hygiene is so important.
Yeah.
Here's another question that somebody wrote in for you, Dr. Weissman. The situation is changing daily in our state and around the globe. What have we learned about the coronavirus and the response since the first case was confirmed here in Washington?
Well, we've learned a number of things. First of all, that for most of us, the symptoms, if you get this, will be mild, and we expect a lot of folks to become infected with this. But there is, for our folks who are 60 and older, or folks who have chronic underlying health issues like cardiovascular disease, kidney disease, that can be pretty severe. So we've learned that. We've learned that the incubation period, as the mayor said, is about 5-6 days. And so that's where we get some of the doubling. So if you become exposed, you might start seeing symptoms in 5 to 6 days.
I want to ask the Mayor Durkin, from a governmental standpoint, what is your assessment of how we've responded as a country? Because we've talked to doctors who say we just don't have enough test kits. We knew this kind of thing would be coming, but just as you've looked at the overall scope of our response, how would you grade it?
I would say that we have been significantly hampered in our response by the lack of testing. And I think both the CDC rules about who could get tested and the lack of kits ended up hurting us here regionally because we missed how much it had spread in the community. And even today, the best numbers we have are from the modeling from this amazing research community we have here, because we don't have enough broad-based testing to really know how broadly this is spread. I think that gets better over time. We still don't have enough capacity here to test people who I think need to be tested. We're getting close. But as we build that capacity, that will help other cities across our country and other states deal with this, because they'll be able to decide really what strategies are going to work best to stop the virus. So I would say that hampered us. Since we did learn of it, I can't give enough compliments to our Department of Health, our King County Public Health, all our government coming together. It's an astonishingly fast-flowing process. And all of government's involved. It affects everybody in our community in so many complex ways. And I think people need to know how hard this might be and how big these numbers are. I think that's why it was so important for the governor today to be honest and say, we might have that many people infected here. That's why we have to take these strong actions.
Can we talk about the test for just a moment? Because it's my understanding, and please clarify if I don't have it exactly right, but it's my understanding that Germany got the test about a week after China sent this genome out, months ago. They ramped up on getting tests. And then Iran and Italy and many of the countries in Europe, the WHO came out with a test many, many weeks ago for the coronavirus after China announced that they had it. And the United States said, no, we aren't going to take that test. We're going to make our own test. And that is why we're seeing all of this testing happening all over the world, thousands of tests in all of these other countries a day, because when we made our own test, it was flawed. And we seem to be woefully behind the rest of the world when it comes to being able to test Americans. Is that accurate?
Well, I would say that the CDC really quickly developed the test once they had the virus and were able to sequence it. So they did produce the test, I think, in record time. I think our challenge is in part that we didn't get the tests out very rapidly to be able to have wide-scale testing and to have the availability of it. We really had it limited to our public health departments early on, and that, I think, as the mayor said, probably slowed down our understanding of how much virus really was in the community.
And if we didn't have the University of Washington and folks like that right now helping and standing up more lab capacity, we would still be in that spot. So Joyce, I think you have hit a really important thing, which is in the next pandemic, people have got to get ahead of it. There's no reason why the United States of America couldn't have better testing, broad-based testing, and we still don't have what we need. So I think that we, working with the scientists, the government needs to let people like Bill and Melinda Gates Foundation, who've developing a home test kit. If you can do 23andMe at home, this is more complicated than that, and it's got to tie back to public health. But we got the best logistics companies in the world here, the best researchers. Let government unleash them so that we can get testing.
And maybe no more cuts to the NIH and other federal. There have been significant cuts, have there not?
Yeah.
Right, there have, and the Centers for Disease Control and Prevention, which really fund the sort of public health response, and really this is a local response. This is about, in local communities, our local health departments being able to respond, to be able to quickly identify cases, isolate those who are sick so they can stay home, identify their contacts. That's how we're going to solve this and increase our social distancing. That work takes time and staff.
All right, we're going to get back to the mayor. Please, I know you have to go soon, but stay for just a little longer if you can. Also, our Secretary of Health in just a moment. We're going to be talking about all the schools that are closed and how that's impacting parents and students. We want to get to more of your questions, though, first.
So again, here's the number to text. It's 206-448-4545. Please include, if you can, include your first name and where you live. Jessica Janner Castro is here with the primary care doc, Teresa Girolami, to answer more of your questions. Jessica.
Yes. Hi, Mark and Joyce. We are answering our viewers' questions for the next 2 hours. And as you mentioned, I am joined by Dr. Teresa Girolami, who is a primary care doctor at Bell Red Internal Medicine in Redmond. Doctor, thank you for being here.
Thank you.
Let's get to some of those viewer questions right now. So let's get to it, shall we?
Yes.
All right. So the first question we have here, we heard from people like Shannon, Stacy, and some others who have or know people with underlying medical conditions like diabetes, kidney failure, or respiratory issues, and they've heard that having those underlying health conditions can make them more susceptible to catching the coronavirus. So what underlying health conditions should people be concerned about? Who's at risk?
I think the most at-risk group, it seems so far in the data, is the elderly who have chronic medical problems. So those could be anything from potentially a cancer diagnosis, COPD, my mother has lung cancer, she's high risk, diabetes, hypertension, heart disease. These are the things that we are most concerned about, and that group is probably forefront on our mind right now with the chronic medical diseases or issues and elderly.
And is that the combination we should really be concerned about, an underlying health condition and elderly?
That seems to be the ones that are having the highest mortality in our immediate community.
Okay. Here's another question we have, and it's about telemedicine. A lot of people asking this one. The coronavirus outbreak has forced a lot of people to talk to their primary care physicians via telemedicine, so using FaceTime or any other kind of online communication. What should you tell your doctor when you're trying to communicate and they can't see you physically, they can't touch you and see what you're feeling and hear from you directly?
So that is a great question, and that is what happens every day in my office all day long for the last 2 weeks. So the call is typically the same. I'm worried, I've heard about the coronavirus, I'm having a cough, I don't feel very good, I have a sore throat. But the things we're screening for are the people that say they have a fever, they have shortness of breath, they have a cough. That's high alert for us on the phone without seeing them. It's really difficult right now because this is kind of a new thing for primary care doctors, pediatricians, everybody on the ground out there who's trying to keep the people out of the ER to not burden them. So we are trying to triage them on the phone and trying to assess the most acute people who we think might possibly have coronavirus. We've been asked to direct them to the emergency room, but we are supposed to notify the emergency room in advance that they could be coming in. If they don't have those particular symptoms, and even sore throats on the list now, and diarrhea is on the list, so it changes every day. Then we can see them in the office, and then we can, it's flu season, it's allergy season, people are having asthma. It's very confusing out there right now, and I know it's hard for all the patients out there, so feel free to call the doctor's office. We'll try our best to triage you on the phone, and if we can see you, we'll definitely have you come in, and if we're worried, we're going to say either stay home and try to get better on your own, and we'll reach out and talk to you later. But I hope you're all right. Today we actually called all of our patients over the age of 85 and reached out to all of them and called them all and just made sure they were okay and following all the precautions that have been mentioned previously.
And then real quick, one more question for you. Is the coronavirus less or more contagious than the flu? Because you did mention it's flu season.
I don't know if we know that yet. Maybe an expert on the show will know more than I. But someone called today and said she had 103 fever and a cough and she thought she had the flu, but that ticks the boxes for coronavirus right now, so it's getting very confusing. So that was a tough one to try to triage on the phone today.
Doctor, stay with us. Obviously, you're going to be here with us for the next few hours, and we're going to be answering all of your questions. Keep sending those in to the phone number that we have there on your screen. And Mark, Joyce, back to you.
Okay, Jess, thank you. Let's get back to the Secretary of Health for the state of Washington, Dr. John Weisman, and also Seattle's Mayor Jenny Durkan.
So, Mayor Durkan, the big announcement here today, of course, that you know, starting tomorrow, Seattle Public Schools are going to be closed, no online classes. A lot of parents obviously grateful that's going to help to stop the spread, but it's going to put a lot of strain on lots of families. So what about childcare? I know a lot of families have questions about what they're supposed to do about that and if the city is going to offer any help.
So I had conversations with Denise Juneau, the superintendent, today. We've been working with them for a week, hoping that we could avoid immediate closure like this. And there's three things we want to make sure is, number one, a lot of kids depend on the schools for nutrition. We have a number of kids with free and reduced lunch. And so we've talked to the school district and say they have to come up with a way to get those kids fed. The second is childcare. I mean, their domain is taking care of kids through the day and educating them. And so I know they're working on a plan to see whether they can put their facilities and employees to work in a way, because one of the impacts no one thinks about is not just every parent, but a disproportionate number of our frontline healthcare workers have kids in K through 12. Wow. And the estimates of how many people will be pulled out of the healthcare workforce at a time when we need everybody there is really going to have an impact. So we're working with the schools, and we hope that they can come up with a solution very quickly.
Okay, here's another question, this one for Dr. Weisman. We reported yesterday that medical providers at some hospitals say that they're having to share masks and gowns due to a shortage. Agnes, one of our viewers, wants to know why Washington doesn't have a better and more advanced response when it comes to this.
Well, we're really concerned about our healthcare providers and keeping them safe as they provide care. And what we know is the global markets in terms of producing these products, many of them come from China, have really been seriously impacted by these personal protective equipment, masks and gowns. We're working really hard with the healthcare system to assess those, make sure that our healthcare providers have what they need, and working with the federal government on requesting assets that they have in the Strategic National Stockpile to get those here. That said, I think the government has to really make sure that they work with companies and really increase the production of those products.
We have another question for Mayor Durkan. This one comes from Michael Goodheim asking if the gathering of groups of 10 or more are not advised, why is public transit still operating?
So the guidance today was any gathering over 250 is prohibited. Any gathering below that, they're going to have to follow the very specific recommendations of King County Health. Transit is taking additional precautions, and as they announced today at the press conference, Metro and Sound Transit are going to spread people between the trains, sanitize them more often. People have to get to and from, so we're going to try to do it in a safe way. We'll rely on our public health partners. If we have to go further, we will.
Yeah, some people don't have cars, right? And they have to rely on transit to get to work. Dr. Weissman, a viewer is wanting to ask, as a public health official, how far do you go to make sure that people are complying with the restrictions that have been implemented? Governor Inslee was asked this at the press conference today. The question is about enforcement. I mean, is there a plan to crack down if people aren't doing what they should?
Look, here's what we know. A week ago, Seattle really strongly encouraged event organizers to reconsider some of their large events and encourage them to consider canceling them. We found many of those did that. They were concerned, they responded. That's exactly what we think is going to happen here. We know that people want to keep their family, friends, and neighbors safe. So we're really expecting that folks are going to comply with this because they want to do the right thing. And Washingtonians believe in science and believe in doing the right thing. So we're confident that folks are going to heed these warnings.
Another question, this is for the mayor. Lori wrote this and asked, how will King County help people who are homeless avoid contracting coronavirus?
So we've been working, the city of Seattle's been working very closely with King County and the state on this issue. In fact, working with the public health people, we have stood up a whole system of new shelters, mostly so we could take the shelters we do have and not have so many people in them and be able to do that social distancing. We're also monitoring people in the shelters. We've created isolation places to take people who might be exposing symptoms. We know we have to do more. It's one of the specific asks that I asked Vice President Pence and asked him again, is we need national help in case, if we need the resources to have mass housing or shelter as well as medical things, we're going to have to turn to the federal and state government for that.
Okay.
Okay, so for both of you, a viewer is asking this. What worries you the most about this virus? Mayor first.
So I think it is our vulnerable populations. We talked about the homeless. We really need to get in front of that, and it's going to be a regional issue. The second is making sure that as we get through this, it is going to be really hard. And it's going to hit vulnerable people both health-wise and economically. And so we're trying to do everything we can up front to build some resiliency in, because the public health officials tell me that we're talking months, not weeks, and we're in it for a very long haul. And so it's the duration of it and how we come out the end. And so I'd say to everyone, it's going to be hard, but we're all in this together. We're really going to count on people to be smart and be kind and be compassionate. That's the only way we will make it through.
Dr. Weissman, some people, as a media organization, we hear both sides. Some people say, stop freaking out. Other people say, thank you very much. Just from your perspective, are we striking the right balance right now in our response to this?
Well, we've been dealing with this for 50 days in terms of planning ahead, and I think the public is sort of just catching up to see how severe this really might be. So what I want people to understand is this is very serious, and we need everybody to be very concerned. At the same time, you can take action. We know what to do, how to keep ourselves safe, how to keep our families safe, how to keep our community safe. It's going to be extremely disruptive, no doubt about it. When we're talking about shutting down events as we are, when we're asking people to change their ways, our elderly and those with chronic disease not to go out, that's extremely disruptive. But it's the right thing to do. And if we do that, we're going to get through this. And I think as a country and as Washingtonians, we're about taking care of each other.
Yeah. And doing the right thing, right?
Doing the right thing.
Some people can't find toilet paper at the store and that doesn't make sense. So act, but do the right thing, right? Yeah.
And try to keep other people safe, even if you're feeling great and you're a young person, getting together in big groups. If you're feeling sick, stay home. Do all the things that we've been advised to do.
No handshaking.
Yeah, no handshaking.
Dr. Weissman, Mayor Durkin, thank you both so much for your time today. We really appreciate it. I know our viewers appreciate you answering their questions too. We have some more guests coming up tonight. Dr. John Lynch, an infectious disease expert, also the Associate Medical Director of Harborview Medical Center. We're going to get to him in just a moment, and he will answer some of your questions. Stay with us.
But first, we have seen several questions come in about what surfaces the coronavirus can actually live on.
So Greg is here with some answers about that. Greg?
Try to walk you through some of this. So this is a big one, and the good news is you shouldn't have to worry. So that virus spreads person to person, but it doesn't live on surfaces for very long. So by the time the mail ends up in your mailbox or the package arrives at your door, you should be in the clear. So what about other surfaces like handrails or doorknobs? Well, it's incredibly unlikely you'll pick up the virus from those either, even let's say I sneezed into my hands and touched a doorknob, which you immediately touched after me, you wouldn't automatically get sick. You'd really have to kind of put your hands on your face. The key here is COVID-19 cannot survive very long outside the body. Now, there are plenty of other questions coming in our text line right now. Let's get to Jessica Janner-Castro and primary care Dr. Teresa Girolami. Are we still answering questions over there?
Oh, we are. And we're getting a lot of questions from our viewers, so keep sending them in. Of course, we want to hear from you as we continue our coverage. And Doctor, thank you for being here.
Yeah, thank you.
Okay, let's get to some more of those questions. And Nikki Watson says, my whole household, including myself, were really sick in January this year, and I thought it was the worst flu I had ever had, but I never vomited, I wasn't congested, I feel horrible, and it was hard to breathe. Is it possible we just had the coronavirus and not the flu?
I think it is possible. Usually we like to see if it's a true case, a symptomatic case. That would be a high fever and shortness of breath and a cough. But you can have very mild symptoms and still have had the coronavirus, and we might not have ever known.
Okay. Doctor, your office, I know, has limited access to some tests. And one question that viewers had is, how are doctors deciding who gets tested?
That is a great question. We were informed last Friday that we could actually order testing kits. So we were allowed to order 14 kits only.
Just 14?
Just 14.
Wow.
And they have not arrived, and I have not seen them. And I probably am not going to see them because I think there are probably other places in the state that maybe require them more than my office. So who gets tested is a great question. And I've had many people call and say, can I get tested for the coronavirus? First of all, I don't have the test, so I can't do it. But the highest acuity, obviously if you had a limited number of tests, you would only test the highest acuity, but those are the people we're trying not to have in the office.
Okay.
So we're trying to send them into the emergency room if we really think they're a high likelihood of being positive.
So defer to an emergency room when you're trying to get tested. Call your primary care physician,
Yes.
and they will tell you whether or not to take steps towards an emergency room.
Yes.
Okay. Our viewer, Buddy Howe, asked this question. He wants to know a little bit more about the testing process. So he's asking, is it just from a blood draw? How does it all work?
So it's oropharynx in your mouth or up your nose, like the flu swab, which is not a pleasant test,
No.
and it's not a blood draw, and it's a swab way up in your nasal cavity, or 2 swabs I think we're doing for coronavirus.
Ouch. Does
And
it
then-
hurt?
Yeah, well, it makes your eye water, and and I always say if your eye didn't water, I didn't do the test right. So it's not pleasant.
Okay.
But it's very short-lived. It's seconds.
The doctor, of course, with us throughout our special show, and we want to give you the number again. It's 206-448-4545. Please send us your questions. We'll do our best to get to them. Mark, Joyce, back to you.
Okay, thank you, Jessica. As we continue our live town hall, we're going to be answering your questions about the coronavirus. We have another expert in studio now to talk with, Dr. John Lynch, an infectious disease expert and associate medical director at Harborview Medical Clinic. Thank you for being here.
Dr. Lynch, really appreciate it. We have so many questions, really lots of people, so we want to get right to one. This is from one of our viewers. Let's listen to this.
My name is Eddie. I'm from Seattle. And my question is, how long do you think this will last? And how long do you think it'll take for them to find a cure?
Yeah, sure. So that's a really good question. I think it's kind of the $1 million question. I mean, at the very least, we're going to be in this for weeks, if not months. You can just see the disruption that's happening only about a week and a half really into this outbreak. And so you can just kind of imagine the forecast. I think our public health colleagues, Dr. Jeff Duchin and others here locally have sort of forecasted 4, 8, maybe 10 or longer weeks in dealing with this. But I want to recognize that that's sort of the forecast and the potential, but there's still a lot we can do now to maybe mitigate and shorten that. So that's the possibility, but still a lot of potential to change that.
Over that many weeks, will it operate sort of like the flu, where it will peak and then it will diminish? What do you expect to happen? And at the height of it, hypothetically, how many cases might we see?
Well, it's, as I think Mayor Durkin just mentioned earlier, we're looking at a very rapid increase in the number of cases every day. We could pull out the charts, but I can just tell you at my own facility at Harborview Medical Center and through the different hospitals in UW Medicine, we're seeing an incredible increase in the number of cases, both in the community. We know the outbreak in the skilled nursing facility and other places going on that's really hit us pretty hard. As far as numbers, really hard to predict. Someone has plotted where we are on the outbreak in Italy, which is climbed quite astronomically, and you saw the impact there. And we're kind of right where they are in terms of the number of days and the number of cases. So just bring up that statistic, and it's quite sobering.
Well, another viewer wants to know, Seattle, and probably more specifically or more generally, Western Washington saw the first case of coronavirus. Now 29 people have died in Washington state. The question from our viewer, why is the coronavirus outbreak here worse here than other parts of the country?
It's a really good question. And again, I look at my public health colleagues with their expertise around that, but my perspective on that is that we had a couple things going on. We have an incredible medical community here. Obviously, there's great doctors all over the United States, but we had people on the lookout here. We had the patient from was hospitalized in Everett, so I think our awareness was really high. And then a couple things happened. We had access to the lab, right? The state lab was activated and able to do the CDC test right around the same time that the CDC changed its case definitions. And Dr. Frank Rito at Evergreen, who made that first diagnosis up there, that was the same day. It was this patient with a very bad pneumonia and access to the state lab, and he was able to sort of make that connection, that diagnosis, which then allowed the rest of us to understand what was going on. So it was really that combination of access to testing, clinical awareness by our colleagues here in Seattle, and the CDC case definition that allowed us to get the test done. And now that we've got access to the test at the University of Washington, we're seeing all the cases. You can't see the cases in the outbreak unless you have the test.
And in terms of severity, unfortunately, it started in a nursing home, right?
Well, that's where we're seeing the bad outcomes. But the question is how much of it is actually circulating in the community. Generally, a rule of thumb when we think about these types of outbreaks is when you see a death, that means that a lot has already happened. And that's the big concern, is how much of it's in the community. And until we're able to do more testing in the community, we're not going to have a full understanding of what's going on. So again, having access to that test is one part, but able to do it safely in clinics, right, in emergency departments and other care places is really the big challenge now.
Can you explain to us why it seems that children are not getting this virus? What is it about their immune systems, thank God, that makes them sort of not susceptible?
Yeah, it's fascinating, and I really rely on my virology colleagues to answer those questions, maybe pediatric colleagues as well. But you asked earlier, what are we looking at in terms of numbers? Well, one of the big things about the seasonality of influenza, right, is it comes up and then it goes away, and it's associated with seasons here, particularly in North America. Part of the thing about influenza is that all of us have some level of immunity to it, right? We've seen lots of different influenzas over the course of our lives. And coronavirus, we don't have any immunity to. And so you're sort of seeing it prey on specific parts of our population that may have historically had some immunity to things like flu. Why it doesn't hurt kids is really interesting and puzzling. We're all used to the little 4-year-old with awful stuff coming out of his or her nose, running around happy as can be.
And building up an immunity as they get older.
They may be just not, they have all kinds of stuff, but they feel fine. They don't have a fever. And then their parents get it and they're knocked out, right? And so maybe it's something like that. You got to remember there's other coronaviruses, right? There's 4 human coronaviruses that we get all the time.
Didn't know that, actually.
Yeah, it's actually really important to recognize that when we talk about coronaviruses and infectious diseases, that's my specialty, is that there's actually 7 coronaviruses we've known infect humans, right? 4 normal ones that cause colds. And so you up in my hospital and many other hospitals, you can get tested and you can be positive for coronavirus, but it's not this coronavirus.
Wow.
And then there's the 3 new ones, right? SARS-1, SARS-2, this one, and then MERS, which you've heard about before.
You're going to stick around because we have more questions. I also want to talk to you more about populations that are at risk, which are not just people who are elderly, but people who have compromised immune systems. But first, Jessica Janner Castro is taking lots of questions. She's with our doctor, Gianami.
Close.
Oh,
close choice, but
anyway, Jessica, take it away.
Dr. Teresa Girolami, she's a primary care physician. Thank you for being here, Doctor. Dr. Girolami, we are having a lot of questions from our viewers about what to do to keep a normal life and balance all of the headlines surrounding coronavirus. So a lot of questions rolling in about air travel, trips, going to the movies, etc. So a lot of people also saying that they're afraid to go to restaurants. What's your advice? How do you stay safe but also live a normal life?
Great question, because every day something changes, and today was a big day in the news. So now we're not to go into crowds of 250 or more, I believe was the announcement today, and then the air travel just was canceled a couple hours ago by the president.
To Europe.
To Europe, yes. So I think if you want to have your normal life, you want to go to the grocery store, obviously if you're well, go ahead and go out. I think you should go out. I think you should use 6 feet, the 6 foot rule. Make sure that you're not around people that are coughing. If you're sick, I don't think you should be going out, but you should be the one wearing the mask. So it's not really advised by the CDC today for the healthy people to be wearing a mask. But if you were potentially sick or thought you might be sick, you should wear a mask if you had to go to the pharmacy or something like that. Good hand washing, hand sanitizer. I've gone out, I've gone to the grocery store and picked up my kids and did all those things. And I think you can do those things. You just have to be, every day, cautious.
Okay. Another big question our viewers are asking is, if I have an elderly family member, should I simply stay away from them even if I'm feeling okay? Should I stay away to keep them healthy?
That is a great question that I'm struggling with personally with
Me
my
too.
mother with lung cancer.
Yeah.
So I have not gone to see her because I'm a healthcare worker. So I didn't go, but my brother's in the household, he's well, and I said, just don't have anybody come into the household that could cough or breathe on her. But she's immunocompromised with lung cancer. If your parents are well and healthy and you're well and you feel like you've not had any known exposure, I think you could visit them.
Okay. And on the flip side of that, I just saw someone send this question in. They said, I'm 66, so I'm above 60, but I feel healthy. I don't have an immunocompromised system. So can I live a normal life? Should I be extra cautious?
That was interesting when they put on the over 60 and the pregnant ladies on the list of higher caution. Yes, I think if you're fairly healthy and you want to go out for a jog, I think you should be able to do that.
Okay. Keep sending your questions. We are looking through all of them. We're trying to get to as many as possible. 206-448-4545, and I'll be back with the doctor shortly. Back to you guys.
Okay, thanks. Let's get back to Dr. John Lynch from Harborview Medical Center. Essentially, his job at Harborview is to make sure that diseases don't spread within the medical community. So you're the perfect guy for us to talk to. It's good to have you here. Here's a question from Ashley in Gig Harbor. Here's what she had to say. Take a listen.
Hi, I'm Ashley from Gig Harbor, and I'm wondering if it is safer to travel in-country than out-of-country through an airport.
Good question.
Yeah, so I think this is, as everyone's saying, is changing super fast. I'd say right now, getting on a plane while healthy, washing your hands, keeping your area clean is probably reasonable to do. There are some risk groups that may be a little more at risk. So for instance, if you are an elder with potentially medical problems, or maybe your immune system's not working really well, maybe it's not the best bet. We can definitely see, as you've seen different celebrities and basketball players getting infected, this is really happening kind of all over the place. And so I don't know for sure where it is until we get more testing, but in general, if you're a healthy adult, washing your hands, keeping an eye on your surroundings, it's probably okay to fly around our country.
There are a lot of young people in their teens and 20s and 30s who have compromised immune systems because maybe they're taking a medication like Remicade or some other autoimmune suppressant drug. Are they in the same risk group as somebody who's elderly?
Well, we're still learning. So I think when we think about the risk groups, and our public health colleagues put out a message recently saying that if you're immunocompromised, really for any reason, if you're over the age of 60, but I think really over the age of 60 with other medical problems, heart disease, lung disease, liver, kidney disease, those things together probably put you at greater risk, are probably the biggest groups. They also listed pregnant women, but interestingly, the amount of data that we've got out of the Wuhan situation seems to see that they don't like kids.
I heard that today.
Don't seem to be have as bad outcomes. And there's actually a paper that just came out in the New England Journal today showing that there's no evidence of transmission to fetuses and babies when they're born, which is, I mean, when you think about flu, you asked me that before, no kids, and then right now we don't have evidence of this hurting pregnant women, which is what flu does. Yeah, remember, kids in our state have died from flu this year.
Yeah.
I heard today in Wuhan there were 9 women who were pregnant who contracted it. All of their babies were born healthy.
Right. They were all in the 3rd trimester, so it's going to take us some more time to learn about the 1st and 2nd trimester, but I mean, wonderful data. Really, really relieving.
Another viewer writes, how long could this coronavirus outbreak go here? Will it go away in the summer when things heat up? So you've looked at other coronaviruses. Could it be possible that as things warm up, it dips down, it maybe comes back in the fall and winter, and by that time we may have a vaccine?
Yeah, I think those are both possible, and I am really concerned. We saw this in 2009 with H1N1. If you remember that, we had a pretty rough flu season in the spring, went away in the summer, and then it came back. It was actually much, much worse in the fall, right? You got to remember, in the United States, we do lots of things when it gets cold, right? It gets cold, humidity changes, but we also change our behaviors. And so there's a lot that goes on. I'm very happy if we get a really, really early summer and the temperature goes up and this goes away, and that gives us time.
Right.
This whole thing is about delaying that. You saw that curve earlier?
Right.
The whole thing is about how do we slow that down so we can absorb it as a population.
Here's another really great question from Lori. This is on Facebook. She says, quoting now, "This is just another strain of the flu. This happens every year, and it is the media that's making it worse." She pointed out that thousands of people die from the flu every year. How is this different from the flu? Why is it not the same thing?
No, it is very important to recognize that influenza is a very dangerous disease for many of the same risk groups, particularly older folks. And we've, almost 100 people have died in Washington State from this disease. We cannot take our eye off of that, just like we can't take our eye off an ongoing hepatitis A outbreak right now in Seattle. But this is different. It feels different. I'm watching it at the front line. I've seen these patients with this disease. We're seeing it really prey upon people who are much older, people with a lot of other medical problems. And the problem is by the time we find out about it, it's often too late. And you've seen and talked about the deaths. They come in very sick and die very, very fast. We're seeing unique things about how it manifests as a disease that's very different than influenza. But our clinicians are learning every day about how to handle it. Other thing to remember, all of us have some immunity to influenza that mediates how it works. This we've not seen before. This is brand new virus. And a reminder, we've got a handful of very sick 20-year-olds in our hospitals right now with this virus. So we're learning every day.
Yeah. One more viewer question. Allison Anderson writes, "I would like to know of a person who has recovered from the virus. How did they feel while they were sick? How long were they sick? What were their symptoms? How do they feel now?" And we've talked to some people and had their stories on King 5. I guess the answer is it depends, right? Who you are.
This is, again, we're learning a remarkable amount every day. So as part of our Harborview team, we've done work with our public health. We've gone out and tested people in their homes. This helps us keep people out of our emergency departments and clinics. I saw a patient a couple weeks ago. I'm like, that's the flu. Muscle aches, a little fever, wasn't hungry, headache, tired, sitting in a chair. I'm like, I've seen flu 1,000 times, that's flu. I was totally wrong. That was COVID-19.
Wow.
It looked exactly the same. And our learning about the manifestations of this disease are going on and on. Chinese press, they said in the science there said, for instance, a runny nose, not a problem. We're seeing people diagnosed with that. Very sore throat, which we don't think of as going with some of the other kind of cold-like symptoms or syndromes. We see that with this very commonly. And so it's just but we're learning all the time, and I cannot tell you that this square is COVID-19 and this square is everything else. And that's actually one of the big impacts in our clinics and our hospitals, because right now we have to test everyone.
Wow.
Let's talk about the hospitals, because really they're on the front lines of this. How might this, now that it's a pandemic, impact our hospitals and our healthcare workers? Can we absorb it?
You're asking a ton of really important questions, and I think this is a crucial one right now in our city. So you got to think about hospitals as like electricity and water. In an earthquake, those things break. You don't have access to clean water. You don't have access to electricity. Our hospitals the threat here is we're going to break them, right? We don't have 1,000 extra beds with 1,000 extra nurses who can take care of all the stuff we normally do and then throw on an epidemic on top of it. In addition, when our healthcare providers are taking care of these patients, they need to protect themselves. You've probably heard about the impact on healthcare workers in Wuhan. It is not a good picture. We have to keep our healthcare workers safe. They are a precious resource. So they need to be wearing gowns and gloves and masks and eye protection. And we need to be taking care of patients who have this, or even waiting for the test to come back positive or negative. That takes a lot of equipment, a lot of time, a lot of training, and it displaces the care we already need to provide to people. My hospital is a trauma hospital. It's a burn hospital for 25% of the U.S. landmass, right? It's a level 1 for the Pacific Northwest. We also serve the homeless community and other at-risk populations. We have to continue to do that while absorbing all of these cases. And that's true for all the hospitals in our county right now. It's a real threat.
Okay, out of time, but if you had the ear of elected officials here, what is your statement you'd like them to know tonight?
I think they need to get into the hospitals, and I think they need to be talking to the hospital leadership and our frontline folks. I think we need help. I think the hospitals need that attention. We are capable of doing this, but I think we need to do it in a coordinated fashion with our public health folks who are they need to be well resourced in the way that they have in the past. We need to be thinking about our healthcare sector in a similar way, right? This isn't just like paying for surgery. We need to be thinking about how to cooperate and work together, and then finally being led by our government leaders.
You know, my husband's a physician, and I know he worries about his staff and the nurses. And as the numbers go up and people are coming to the hospitals, our nurses and doctors are on the front lines. And are you worrying that as the numbers come up and there's no cure, there's no vaccine, you know, they're coming to work, exposing themselves potentially to a virus and going home to their families, that maybe nurses will, or healthcare workers will stop wanting to come to work and putting themselves at risk?
Well, I have to say the healthcare community in Seattle is extremely strong, and we're seeing, you know, incredible camaraderie and dedication, particularly I know at my hospital, but Evergreen, and it was in the paper today, just amazing people doing this. But we have to acknowledge their fear, and that's real and normal and appropriate. But we've got to make sure we provide them with the right tools so that they're safe. Every time, 100%. They actually have to come before everything else so we can do the patient care that's desperately needed for the entire community.
Well, please pass along our gratitude to your staff at Harborview and all the other hospitals out there.
Yeah.
So grateful.
By the way,
for
he hasn't
work you're
slept.
doing.
Yeah, I haven't slept for 2 weeks.
I'm drinking lots of coffee.
We really appreciate you coming in.
Dr. John
I know our
Lynch,
viewers do
Harborview
as well.
Medical Center. Thank you so much, Doctor.
Thank you for having me on.
Yeah.
So we've seen so many of your questions coming in about the virus and how it spread.
So Greg Copeland is back with what we've been able to verify about that. Greg.
So many questions, you guys. There are a lot of misconceptions about how far away you have to be, and if you touch somebody, what happens. So here's what we know. The coronavirus is thought to spread mainly from person to person, between people who are in close contact with one another. Doctors consider close contact within about 6 feet. If an infected person coughs or sneezes, those respiratory droplets can land in the mouths or noses of people who are nearby and possibly be inhaled into their lungs. It can take as few as 2 days or as long as 2 weeks after exposure before someone starts showing symptoms. Common ones include fever, cough, and shortness of breath. It's also flu and allergy season, so how can you tell the symptoms apart? For the flu, you'll also have muscle aches, fatigue, chills and sweats, congestion, and a sore throat. For allergies, there's lots of sneezing. You might have an itchy, runny, or stuffy nose, and itchy, watery red or swollen eyes. There are plenty of other questions coming into our text line right now. Let's get back to Jessica Janner Castro and Dr. Teresa Girolami. Guys?
Yes. Hi, Greg. I am here with Dr. Teresa Girolami, a primary care physician, and she is answering all of our viewers' questions. Keep sending them in, and thank you for those of you who have sent questions in. This one is from Glenda Atchison, who wrote on our Facebook page, and she said she wants to know if antibacterial hand sanitizers are actually helpful against this virus.
So what's recommended by the CDC is an alcohol-based hand sanitizer or antibacterial soap. Okay. Yes, they're very helpful and highly recommended at this time.
Okay. Here's another question from one of our viewers that came in. Should we stay away from our elderly family members in order to keep them safe? And we answered that a little bit earlier, so if you'll just reiterate that one for us. But also, what can we do for our elderly family members during this time?
I think if you're healthy, you've not been exposed, you haven't traveled, we don't have any known reason why you should have coronavirus, I think you could probably visit your elderly parents. Do be a little careful. If you can run an errand for them, if you could go to the grocery store, if you could go to the pharmacy, make sure that they're all stocked up and all of that, I think that would be incredibly helpful.
Okay. I asked you this, we were chatting a little bit about how to stay sane during all of these headlines, and you mentioned that you like to look at credible sources and try to also maybe take a breather every now and then from all the headlines. Can you give some advice to everyone who's watching about, you know, how to balance everything, get the information that we need, but also stay sane?
That's such a great question, especially today. So what I try to do is really see the source. So if there's some crazy headline, I try to see who wrote it or where it came from, and if it's really not credible, then I just try to delete that one. If it's something credible from the CDC or, our public health department, then I'm going to read that. And I'm going to take a deep breath and try to just, go through it calmly and try to get what I can get out of it that's helpful for my patients, my family, our community.
Just a few minutes ago, I saw someone send in a question that said, we've talked a lot about elderly people and their susceptibility, but what is it like to get mild symptoms for someone saying their 20s, 30s, or 40s?
Generally, that's looking like a cold or a flu. They might have a cough, a sore throat, really no fever, no shortness of breath, but tired, achy, fatigued. I know we were talking about it earlier, the phone calls that come in to me when they call and they say that, and I say, do you have a fever? Are you short of breath? And they say, well, I didn't take my temperature.
Okay.
And that's really difficult for a physician. I have to know that data. All the docs need to know what your temperature is. So please, if you're going to call in, get that data point. It's very helpful on trying to figure out, who we really have to worry about. But generally, it'll look like a cold.
Okay.
Usually the symptoms will subside.
Okay, good to know. So get that thermometer handy if you are feeling sick. Again, the number to call, 206-448-4545, and we'll keep answering your questions. Mark, Joyce, back to you.
Okay, Jessica, thank you. Meantime, Washington State senior senator called on President Trump today to issue an emergency disaster declaration.
King 5's Chris Ingalls spoke with Senator Murray in the U.S. Capitol today. She expressed frustration with the federal government's response to the crisis here in our state. We also asked her why didn't she push the federal government to respond sooner?
We had been assured by CDC and FDA from the end of January that tests were being sent to our states. 2 weeks later, we find out that they weren't. A few weeks later, they're saying that we're going to have 1 million. There wasn't. Then the vice president is telling us that there's 1.5 million. The Secretary of Health Education, 4 million. None of that true.
So that was more than a month ago. So Chris asked, is the federal government on track with providing assistance now?
I still am not hearing from them a real sense of urgency, number one, that meets the urgency that I feel on the ground in Washington State. And I still don't see plans in place to deal with what prospectively may come at us, whether it is school closures and how to deal with kids who don't have access to nutritious meals, whether it is homeless shelters and how we can house them.
And we also asked, what specifically is your office doing to help the people of Washington during this crisis?
We need to make sure that we have policies in place that assure people that unemployment insurance and other resources are available to them and to their business owners. And we are working on all that. That's what we should be doing. Let's target this to the people who are being impacted, not just throw out a lot of money that doesn't have an impact on making sure this crisis gets in control.
All right, Senator Murray from earlier today. President Trump has pitched the idea of eliminating the payroll tax for the rest of the year to try to ease the burden on American business from the virus. He also has defended the federal government's response to the outbreak. We've got a lot more to get to tonight. We're going to take a quick break, but we will continue to answer your questions for one more hour.
King County Executive Dow Constantine is going to be here. Dr. Anthony Chen from the Tacoma Pierce County Health Department will be here as well. Another hour ahead. Keep your questions coming, too. We'll be back with another hour after this. Well, welcome back and good evening to all of you. We are continuing to answer your questions about coronavirus and its impact here in Washington. We really appreciate your time and also all of the questions you've been sending. I'm Joyce Taylor.
I'm Mark Wright. So with a new virus and now an unprecedented step by our state government to contain it today, there's a lot of uncertainty about what happens next and just how worried we should be. So for the next hour, we're going to give you facts, not fear. We've got a panel of experts in studio to give us honest and verified answers to your questions. Tonight's format is pretty simple. You can text us your questions. We'll get to as many of those between now and 9 o'clock. The number is on your screen. It's 206-448-4545. We'll get to those, but first, let's get an update on the virus today. Governor Jay Inslee announced a ban on large events over 250 people. The ban covers social, recreational, spiritual, even large sporting events. It applies to King, Pierce, and Snohomish counties. And there's a further restriction on small events here in King County, unless event organizers come up with a way to mitigate the risk.
There is no blanket order to cancel schools, but tens of thousands of students have learned that their classes are not going to be happening. They were canceled today. The biggest school district impacted, Seattle. They have closed until further notice, and you can see other schools on your screen. Lake Washington, North Shore, and starting Monday, Everett Public Schools will close for a minimum of 14 days.
So more deaths were reported today. There are now 29 deaths in the state of Washington, 366 reported cases. That number will keep going up because more tests are being done. About 10% of the state's tests have come back positive so far.
And globally, this virus was declared a pandemic, which means that it is spreading between people and in multiple countries. Right now, it's in at least 100 countries around the globe. The doctor who serves Congress said today he expects up to 45% of the U.S. population to contract the virus.
And we really are just tonight getting into uncharted territory. 2 hours ago, the president talked to the nation about the coronavirus pandemic, announcing a new temporary travel ban.
His administration is suspending all air travel from Europe to the U.S. for 30 days, not including the United Kingdom. Let's listen to what he had to say.
To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days. The new rules will go into effect Friday at midnight. These restrictions will be adjusted subject to conditions on the ground. There will be exemptions for Americans who have undergone appropriate screenings, and these prohibitions will not only apply to the tremendous amount of trade and cargo, but various other things as we get approval. Anything coming from Europe to the United States is what we are discussing. These restrictions will also not apply to the United Kingdom. At the same time, we are monitoring the situation in China and South Korea, and as their situation improves, we will reevaluate the restrictions and warnings that are currently in place for a possible early opening.
So the president, that was just about an hour and a half ago. Joining us now, King County Executive Dow Constantine and Dr. Anthony Chen from the Tacoma Pierce County Health Department.
It's great to have both of you in studio. Mr. Constantine, first of all, I want to begin with you. A major announcement about air travel. We're a very air travel dependent city and county here. What's your take on what the president did earlier tonight?
Well, we've been working hard to base all of our policy decisions on science, advice from our public health officials, and I don't know the degree to which this travel ban from Europe is based on science and how much it is based on politics and domestic political considerations. I do know that it is important for us to take measures here at home that will help keep people safe. And if the federal government helped us to speed up testing, to bring more materials like personal protection equipment, and to do the other things to contain this virus, we would stand not just our region, but the rest of the country in much better stead.
And what about the schools that have announced closures? I mean, this affects tens of thousands of kids and their families across the county. What are you saying to them tonight?
My own daughter is a kindergartner in the Seattle Public Schools, and it came upon them very quickly that they decided to close. No one is prepared for this yet. We've been encouraging them to prepare to take care of those kids who can't stay at home, to make sure they have provision for school lunches and the kids who get medical help through the schools, and simply moms and dads who need to be at work, say as a nurse or an EMT. So those plans are not in place yet. We need to make sure that we get that in place as quickly as possible so that even our response to the virus can continue.
You've been in government for a long time. You've probably sat through more planning meetings than you'd like to admit to. But when we talk about preparedness, we do a lot to prepare for things like earthquakes and floods and other things like that. Are we prepared enough for things like this? Because we know this is going to happen again.
Well, we definitely prepare for events like a global pandemic, but there's no way to be prepared enough. And you can see from the shortage of materials, from the lateness of the testing that Senator Murray was talking about, we have to really speed this up now. And as Mayor Durkin said, I think it was her, that we'll be in stronger shape the next time this comes around. And this is not going to be the last time we see one of these global health crises.
So, Dr. Chen, most of these cases have been in King County. You're from the Pierce County Health Department, but you're bracing, I'm assuming, to have cases there. What is your department doing? What are you telling your people, and what should Pierce County know about the coronavirus?
I think what's important for people to understand is we've been preparing this for a long time. So right after I started 11 years ago, we had the H1N1 flu pandemic, and that really caught us off guard, very difficult. But we are stronger for it, as Executive Constantine said. We have been continuing to plan, we're continuing to be prepared. You know, a lot of times in Pierce County, we're unhappy that Seattle's ahead of us, but here's a situation where we're glad they're ahead of us because we are learning. I mean, we're learning from the rest of the world. And so, but it is taking a lot of resources. You know, public health has suffered significant cuts over the years. I have 280 employees, 60 of them are activated on this, and that's not even counting the many employees that Pierce County has loaned to us to activate
Just for this?
Just for this incident. It's costing us about $125,000 a week. So you can imagine, even though the legislature has appropriated $100 million, that's probably not going to go very far between King County, Snohomish, Pierce, and not to say the rest of the state. But there's a lot of work done, but we have benefited from what happened before. So, for example, recently, because of a large number of cases in King County from the Life Care Center, they had to basically put out a call for ventilator beds and ICU facilities. Well, a few years ago, it started with Pierce and King County. We coordinated our emergency planning around healthcare resources. The Northwest Healthcare Response Network now knows where every bed is, where every resource is. They activated that. They were able to transfer some patients to Pierce County. We were happy that the system was working, and this is a way for us to respond regionally. Now this network covers the whole Western Washington.
So earlier, Dr. Chen, a viewer asked if they should carry on their day-to-day activities. What is your recommendation for assessing as to how much we should change up our daily routine?
That's a great question, because I get asked this all the time, by text or a call from a mayor or a school superintendent. And I said, put this in perspective. And my question always to them is, what would you do in flu season? Why is that? Because we know now that this virus is about as infectious as flu. In terms of fatality, we know it's worse than a regular flu, maybe about the same as a really bad flu season. So if you think about 2 years ago when a lot of people were out sick, now it is half as fatal as the 1918 flu. Okay, but that puts in perspective. So if there's anything you would do during regular flu season, do that. So if you have asthma that's not well controlled and you don't go out to crowds, during flu season, don't go out to crowds now, right? At the same time, don't panic and think, you need to do all these things like buy a lot of toilet paper at Costco. We don't do that during regular flu season. You've seen pictures of people wrapping themselves up in plastic and wearing masks. That doesn't work during flu season, doesn't work now. But this gives you just high level. In terms of people who don't have access to an expert right away, just think about what would you do during flu season.
Boy, that's great advice.
Yeah.
We have one more question, and then I think we might have to take a break or get to Jessica. But what contingency plan do you have in place should this get much, much worse than it is?
Well, as you may have heard, we're busy standing up quarantine, isolation, and recovery centers around the county. There will be about 1,000 county-produced units. The City of Seattle is also creating quite a bit of surge shelter space. And then we are turning to our partners at the state government to help us figure out how we can stand up additional surge space. So if there are more folks who need to shelter, or if there is an infection at a shelter, a detention center, a nursing home, we have some place for people to go to be dispersed, to be away from where they can be infected. Those are critical steps that need to be taken very quickly if we're going to be able to take this thing on.
And what about the purchase of that motel? Where does that stand right now?
There are people now in the motel who are taking advantage of the opportunity to be separated from others and not infect them. We're working on similar facilities all across the county. Mayor Durkin was very forthcoming in bringing 2 sites where we could place mobile units, manufactured housing. And we believe that within just a couple of weeks, we will have hundreds and hundreds of units stood up.
We really are in uncharted territory, aren't we?
Yes.
In your careers, have you ever seen anything even that comes close to this?
Well, I want to remind you, right, when there's no cure, when there's no vaccine, public health still knows what to do, right? Whether it's the Black Death, the plague, Ebola, right? So just a week or 2 ago in Congo, they just released their last Ebola patient. There is no cure for Ebola. There is no vaccine for Ebola, but public health knows what to do. So even though it's a new virus, in some ways, we know what to do. Now we are making sure people are safe, and at some point, you know, our medical partners, our business partners will develop some medications that will help. But don't forget, public health has been here quietly doing its work, but things like isolation, quarantine, you know, making sure we contain the virus, help people get better, that's what we've been doing for a very long time.
So just in case people didn't know what public health was all about, this is what you've been doing all along.
When public health works, nothing happens.
When nothing happens.
Yeah.
And I think that's what this program is about. Enough people are sharing enough rumors online right now. Our goal is to get people to start listening to the experts like you, because if we do that and we listen to the experts, it's going to be a lot better.
So with that, we want to get to some of our viewer questions. So I think we're going to Jessica with more questions to see what people are asking with our doctor.
That's
Jessica?
right. Hi, Joyce. Hi, Mark. Yes, I'm here with Dr. Teresa Girolami. She is gracious enough to join us for these 2 hours, answering all of our viewer questions. And Doctor, we've had such great discussions on and off the air. Let's get to the next question that we got a little bit earlier in the day today, and it was, what are statistics on recoveries? Some news reports say people are still contagious or catch it again after they recover. Do we know anything about that yet?
I would really defer that question to the infectious disease doctors, but I think that we've been using this 14-day quarantine period to really try to make sure people's symptoms have settled down and hopefully they're not contagious after that. I don't think we know yet if people can get it again. I mean, it's a virus. We can get the flu more than one time. We can get mono more than once. We can get strep more than once. I don't know. I think we don't know that yet.
Okay. One of our viewers, George Ann, says, if one gets a mild case of COVID-19, do you develop an immunity like the flu? So that goes hand in hand with the question I just asked you.
Yeah, I was thinking about, I think we talked offline about when the H1N1 came in 2009, 2010, it seemed like the elderly did not get the H1N1 as much as everyone else did, and that was a flu. People just kind of surmised that maybe somewhere in their lifetime they had immunity and had been exposed. So I'm hoping, I don't know if we know, but that maybe at some point we can get some immunity and maybe not get it again, but doesn't mean you can't get a different strain or a different kind. But I think the jury's out on that.
Something we talked about a little bit earlier, and I wanted to reiterate, was you were telling people at home that you do want to check your fever, and you said make sure you have a thermometer, make sure that you can tell your primary care physician exactly what your temperature is, right? Can you reiterate that to folks?
Yes, the CDC recommended that anybody with a temperature over 100.0 would be a tick box on the coronavirus, potentially you having it. So if we don't know that data point, it's difficult to triage that person on the phone. So it's very important that you actually take your temperature and know what it is and let us know. That's a really important data point.
One of our viewers has asked, if you're overweight, are you more susceptible?
I have not seen any data about that. Okay. That is an interesting question.
In light of the question I just asked you previously about having thermometer to take your temperature. What else should you have at home? You know, I did ask you a little bit jokingly earlier, what is with the toilet paper? Can you answer that for folks?
I find that really interesting that people were buying water and toilet paper. And my kids are texting me what's going on. And I said, I'm not really sure because this is not gastroenteritis. So this is a respiratory kind of droplet. We should be buying Kleenex. So, and then the CDC has actually recommended that if you do sneeze into a tissue, that you should discard that tissue into a trash can that's actually lined. So to really get rid of that. And I think I'd be buying Kleenex.
Okay. And of course, disinfectant is really hard to get right now in the store. Is rubbing things, surfaces as well, not just your hands, with soap and water, is that effective?
I think if you can't get hand sanitizer or maybe some Clorox, or in our office we use bleach in the lab, I think those things would be very helpful. Yes, I would use soap and water, antibacterial soap and water if I had it, and I would wipe down all hard surfaces.
Okay. Doctor, we're going to check in with you shortly again, but we're going to send things over to Mark and Joyce, and we'll get back to our viewer questions shortly. Keep sending them in.
All right, Jessica, thank you. So we have just learned that famous chef Tom Douglas has told the Seattle Times he's going to be closing 12 of his 13 restaurants, that sales are down 90% since the beginning of this outbreak. And because of the coronavirus, he's going to be closing all of his restaurants but one, which we think is the bakery that we get his famous pies from, which is on 3rd. But again, that just shows you the impact of this and how small businesses and medium-sized businesses are really being impacted.
From downtown Seattle through Belltown into the Amazon district, Tom has restaurants all over the place.
And has been in business for years and years and years. 90% drop.
So Governor Jay Inslee says the decision that happened today to ban large gatherings came after very careful consideration about the impact and consequences.
So we wanted to give you some time to hear his reasoning directly. Here is an unedited excerpt of Governor Inslee's message to the public today about the ban.
Now, in approaching to this issue, I think it's important to know this. This is an extremely dangerous event that we are facing, but we are not helpless. We have the ability to seize our own destiny and the safety of our loved ones by acting to do what is necessary and effective in reducing the rate of the spread of this epidemic. There is no magic silver bullet at the moment medically, but there is a very successful effort that we can take to slow the spread of this disease, and that's to reduce the social interactions that are not necessary in our lives. This is an effective tactic. It is at hand. All it requires is the will of active people to follow science and confidence that we're all in this together. And that's why we're taking these steps. I spoke with the Vice President about these strategies this morning. We've been in communication with the federal government on multiple levels, and they are going to be issuing some guidance shortly that is very much consistent with our thinking here in the state of Washington. I had a few suggestions to the Vice President. He's been very open to our suggestions over time, and we want to thank the agencies of the federal government that are assisting us in getting access to personal protection equipment and a variety of other things that the federal government is freeing from their stockpiles. These are not easy decisions. The decisions that we're making today and the decisions we probably will be making in the upcoming days are going to be profoundly disturbing to a lot of the ways we live our lives today. But I believe they are the right ones. They are the necessary ones. They are ones based on how we feel about our loved ones and their lives. They are based on science, and they're based on the fact that we're all going to work together to ameliorate the consequences for families and businesses.
Governor Inslee from earlier today. This is already having a huge financial impact on the U.S. Dow futures tonight are already down 1,000 points after President Trump's announcement today.
So the Dow plunged 1,400 points today, another 5%. officially into a bear market now. The fall came after the Dow rallied yesterday a bit, but it's still down 20% from the record close it set just last month at 23,553, down 1464 just today. So it's not just Wall Street that's being hit, but also businesses big and small all across Western Washington and really across the country now. We also heard about school districts in many cities canceling class for several weeks.
Joining us now, Lisa Brown, the Washington Department of Commerce Director, as well as Dr. Michelle Reed, the Superintendent of the North Shore School District in Kirkland. I appreciate both of you being here. Lisa, I want to begin with you. It's good to see you. We go way back to Spokane days when you were in the 3rd District there.
That's right.
It's great to have you here. We want to start with the business side because we're starting to see a very profound impact. Tom Douglas just announcing the closure, at least for now, of his restaurants. We have a question from one of our viewers. Lisa wrote this: if anyone is sent home or a business is closed because of the virus, are employers required to pay their employees for their time off, even if they don't have paid leave? So that's one specific question. What's your answer?
Some employers do have paid leave policy, and employees definitely need to take advantage of that if they are sick. But we now have a Washington State paid leave policy as well. So I really want to encourage businesses and employees to check out either the governor's website or our commerce.wa.gov website, where you can learn about there's flexibility that's been being put due to the emergency into our unemployment insurance rules and our paid family leave rules. So there may be assistance that people are not aware that they may qualify for.
I mean, I'm just thinking about all of the employees at these 12 restaurants that are temporarily closed. That's just Tom Douglas, and what happens to them. They all have incomes they're all dependent on. I mean, what kind of help is going to be available for them?
Well, this is just important to realize that small businesses are experiencing this right now. But as Washington State is a very trade active economy, almost 1/3 of our jobs are tied somehow to international trade. So this will be very widespread over time, exports and imports being affected by the virus. And so, as we heard tonight, the Small Business Administration has put loan program in place for small businesses, but I again would encourage people to keep checking back. The state legislature is also considering assistance programs, and so local, state, and federal government needs to work together now and to make sure we are looking at both workers and employers and the effects on them.
Here's another business question, and then we're going to talk about schools, if that's okay. A viewer wrote in this asking, if I have an underlying health issue, what should I do if my employer is not allowing me to work from home? What rights do I have?
That's a really important question. I don't know that I can answer the rights that they have, but I do encourage employers and employees to look at both our State Department of Health and CDC guidelines. People have compromised health conditions. They are more vulnerable, and this is the time for them to protect themselves and potentially take that health action now, and will address the legal and/or economic consequences as time goes on.
Okay, let's talk about school districts, Dr. Reed. We appreciate you being here.
Thank you.
North Shore was one of the first districts that really started to take proactive action. Today we found that the Seattle Public Schools is closed for at least 2 weeks, and a number of other districts.
Right.
Give us a snapshot of where you are tonight in terms of how you're dealing with the virus and the outbreak.
Well, currently we've moved our instructional delivery to an online model so that we could keep our students and staff safe. And we had a really escalating attendance rate for our students, and we had a large number of staff that fit into one of those 4 high-risk health categories that we were just discussing. We had over 500 staff in that circumstance, so we weren't able to safely open and operate school. But we just finished day 3 of our online learning initiative, Classroom to Cloud, and we actually found that we've only had 500 students absent that didn't log in, which compared to over 7,000 the week before, we feel like we have more students engaged actually in educational conversations, and that's actually a 98% attendance rate, which is generally about 10% higher than we would run in a traditional year.
But not all students are going to have access, right, to virtual learning. So what about other districts? What can they do? What can they learn? What advice can you offer?
So we understand that. We're on the east side of Seattle, and the social justice piece of that, right, and the equity and access. I will say we have loaned 4,000 devices to families who are not able to have devices at home, as well as 600 hotspots, mobile hotspots to access the internet. And I think each community has unique resources, and it really underscores a broader, I think, national conversation around equity and access to technology and the internet, which really, I hope, will continue after this health crisis.
When you had to make that call to shut things down, what was that like? Was there a pit in the middle of your stomach as you had to make that call?
I believe that would be an accurate statement. I was just really prayerful that I'd made the right decision. The health and safety of our students and staff is just paramount.
Yeah. So give us an idea, as you've spoken to health experts, how much better does it have to get before you say, okay, we're going to reopen?
Well, I think what we want to do is track the data, just as businesses are tracking the data, our health department's tracking the data, our governor's talking about the data. I think you've seen the charts. We really know that social distancing is one of the key strategies to slow down the spread of the virus. And so I think we'll continue to look at recommendations for both our students and our staff in the schools and try to make the right decisions moving forward.
So clearly we're crossing into totally new territory. When you look out 4 weeks, potentially, we don't really know where we're going to be, but there's the possibility kids might finish the next month or two online, right? I mean, what does that look like when you're trying to think about how this year is going to go, the rest of this year into the summer? What does that potentially look like?
Well, I think we're in totally uncharted water, right?
Completely.
And so I think that at this point we're taking essentially a day at a time, a week at a time, and just being grateful that we have an opportunity to continue to stay connected with our students and staff and keep them safe and healthy.
I want to go back to Lisa Brown, Director of the Washington Department of Commerce. We heard a story today about how every cruise ship that docks in Seattle brings about $4 million into the city. That's a tiny snapshot of what could be happening in the very near future, or not happening, I should say. As you look at the landscape, you've obviously been talking to economists and others. What's the game plan to make sure that our economy just doesn't flat crash?
Well, it's clear that we're going to go through a substantial slowdown associated with the personal distancing that we need to do during this severe part of the health phase of this. The economic consequences will probably last longer. We are putting together that kind of plan right now. The legislature has left an unprecedented amount of money in their ending fund balance and has tapped into the rainy day fund with a $100 million fund that will be available depending on how those resources need to be utilized. And at some point,
did you say 100 billion?
100 million.
Oh, million. Okay. I was going to say, I didn't know the fund was that big.
This is the state level.
Okay, sorry.
And as we move in past the health crisis part, then we need to go into economic recovery and economic stimulus. I am hopeful that we can get infrastructure spending going again, and once again that these social safety nets and social insurance programs like unemployment insurance are there for a reason. Many employers might be concerned that then their unemployment insurance rates will go up, and we're already looking at how to moderate that or have state funds come in to moderate that so that we can spread out these costs and share them, weather this storm, and then move towards a recovery.
Wow.
And Dr. Reed, I'm curious, if you don't mind me bouncing back and forth between business and schools, how are parents reacting with their students being home, studying from home? A lot of parents work.
Right.
Have two parents in the household that work. So what's been the reaction of families?
So it's been mixed. What I can say is a lot of our families have already been sent home. Microsoft, Amazon, Facebook, Boeing.
Working from home
already. So we have a significant number of our families at home. But for our teachers, many of our teachers have their own students at home. Right. And I think that's been a bit challenging for them. But I think overriding that is parents being grateful for the health and safety.
So they understand the big
staff.
picture of all of this, and they've been supportive.
True. Right.
So we saw a lot of schools announce today a closure for the next couple of weeks. Do you anticipate that will spread?
The closures?
Closures of more districts.
I think that there's a possibility that that'll happen. I think we're seeing the virus map even move, and as the map moves, the context will change for school districts that perhaps haven't seen as much of an impact yet.
Should we have any concerns more broadly about all of these kids who get so much support at school, not just nutritional support and academic support, but social and emotional support that now are going to be home for who knows how long? Should we have broader concerns about their emotional health?
Well, as you know, mental health is a significant concern for adolescents and adults, and in particular with this current health situation. Last weekend, we met with our thought partners from Microsoft, and we're actually looking at what could social emotional learning look like delivered on a distance platform. So we're looking at different options, and we hope to be able to share some things with our families soon.
Okay.
Well, Dr. Reed and Lisa Brown, thank you so much for being here and answering our questions. We appreciate that. Okay, we're going to get you some more information when it comes to masks. There's just been a run on masks in our country, throughout the world. Greg Copeland standing by to talk about whether those masks are a good idea in the outbreak.
Yeah, we've heard a lot about people going to the store and getting all of those masks, and it has been a real problem because most of the short answer is those masks really won't do you much good. So we got a question from a viewer on Instagram. They want to know if they should wear a face mask in public areas. The short answer, again, no. And here's why. Face masks are really not effective in preventing the general public from catching COVID-19. Surgical and dust masks can't filter out the virus particles. They're too small. The CDC suggests only health workers and people who are already sick. Those are the ones who really need to be wearing the masks that are effective. The U.S. Surgeon General is actually urging people to stop buying masks. Supply just cannot meet demand. Companies like 3M that make them are ramping up production, trying to keep up. But face masks made in other countries aren't getting imported to the U.S. right now. So people are being asked to forego the mask and really prioritize their use for healthcare workers instead. The U.S. Surgeon General warns if healthcare workers can't get them to care for their sick patients, that puts them and our communities at risk. Instead, the CDC says the best prevention is just good old plain good hygiene. So wash your hands often. How many times have you been told that in the past couple of weeks? Avoid the close contact. Cover your coughs and sneezes with a tissue or the inside of your elbow. So that's what they're going to keep telling us. Mark?
All right, Greg, thank you. So we are answering your questions, and yes, the doctor is in the house to help answer them.
206-448-4545. That's also the number to call, and you can also put your questions on Facebook. Let's get to Jessica Jenner Castro with more. Jessica.
Hi there, Joyce. Hi, Mark. Yes, I am with Dr. Teresa Girolami. She is in the house, and she's been answering all of the questions for us. Doctor, thank you. Okay, so let's get to some of our viewer questions. One person asking, how is the coronavirus so much worse than the domestic cold or flu virus?
That's a great question. I'm not sure. I heard a couple of the other people earlier on the show say that they thought it was more infectious. All I know is that it's the most infectious that I read online on the CDC when the patient is the sickest.
Okay.
So when they're the sickest, they're thinking that's the time when the patient is most infectious.
Okay.
So I don't know the difference between the flu. I think you shouldn't be around people who are really sick with the flu either.
Okay.
So.
Another question we have is from Sarah from Victoria, BC. She's asking, could this virus mutate to something even more serious? Does anyone know that?
I don't think we know that, but there's been coronaviruses, like as mentioned earlier, forever and ever and ever. And there's some known types, and I'm sure there's many other unknown types. There's viruses we've never identified. So I don't know if it would mutate, or maybe we would just get a new one.
Okay.
And I think that can happen with any virus.
A new virus in the coronavirus family.
Yeah, so like SARS and MERS, and now we have COVID-19. So it's probably likely there's more out there we've never identified.
Another question that we got from one of our viewers was in Spanish, so I'm going to translate it. It's from Victor Ramirez, and he's asking, if someone is sick, is there a good way to maybe help that person sweat out the virus? And he asked about perhaps putting them in a sauna, and I asked you, what about exercise? And then a second part to that question is, if children have a different body temperature, maybe that's why they're not getting coronavirus.
I'm not a pediatrician, but as far as I know, I think children have the same body temperature as we do. But all the pediatricians out there are more expert than I am. Sweating it out is an interesting question because it's respiratory and it's sneezing, and I don't think that's probably what would be recommended. I've not seen that question addressed. The other thing about, obviously, I hope they're not in a community sauna because that would not be advised. Exercising, if you're well and not sick, I think you could go exercise, but I'm not sure it would sweat out the virus.
Is there a way, and this is a question that you and I had talked about while we were kind of waiting for everything and all the action to be happening here during the show, and you and I were talking about things that maybe could help boost the immune system. I was asking you, is there anything that we can eat or drink to do to have a healthier immune system?
So I said that I had watched a show on TV where they had, I don't know if he was a doctor or what he was, but he was touting all these herbs and supplements, and I don't think we really know that those things are true. But what is very helpful is to have good, adequate sleep. Try to be rested, try to stay hydrated, try to stay well. Don't get yourself run down and, go out in an area where you shouldn't be if you're not feeling well already.
Sleep, drink water, and minimize the stress?
Yes. Take a deep breath.
Okay, thank you. Please keep sending in your questions, and we will try to get to them as we can. Mark, Joyce, back to you.
All right, Jessica, thank you. If you're just joining us, this is a special King 5 Town Hall on the coronavirus. All the questions you're sending us, by the way, are being answered, not only on the air, but we have experts online right now, upstairs in the newsroom, answering the questions that we can't answer on the air. So keep those questions coming.
And we will get them answered for you. Joining us again, King County Executive Dow Constantine and Tacoma Pierce County Public Health Director, Dr. Anthony Chen. Thanks again to both of you for being here. Really appreciate it. I want to get right to this question that somebody sent us online because I think it's such a really good one. This person asks, I'd like to hear about the cash that we carry. When we pass it on to vendors, should we be concerned about contaminated bills and coins, Dr. Chen?
Well, I think no differently than we normally would. I think we do not feel that's a major mode of transmission right now. Right? This virus is a respiratory virus. It's normally transmitted through droplets. So someone coughs and sneezes, and you're with it close by, and kind of arbitrarily we're saying about 6 feet to give you an idea of what distance we're talking about, and probably some prolonged exposure. So, for example, if you walk past someone in the line, you're probably not going to get infected. So that, we think, is the major mode of transmission. And so even though it sounds trite, that's why it's so important you cover your cough, wash your hands, because you don't want to be picking this up from surfaces. That's why you do the normal cleaning you would normally do. No need for any special cleaners or anything. But in terms of the money, probably no differently than you would worry about handling money any other time.
A question from Cheryl Whitmore. She says, why is a sore throat and cough not good enough for the coronavirus test? She's wondering if everyone can get a test, and if not, why not? There seems to be some, well, not a clear answer for the general public as to who gets tested and who doesn't.
Right, so you have to remember, again, this is a respiratory infection. So they're colds, they're flus, right? So, for example, one of the ways you differentiate between those two is whether you're running a fever or not. So if you just have a sore, scratchy throat, no fever, unlikely you have influenza or coronavirus, right? So, and we don't want everyone rushing to get the test for several reasons. One is we want to make sure the people who need the test get the test. No different than what you heard earlier about the masks and the PPE. We want to make sure the people who need it get it. Same as a recommendation that if you're not feeling well and you need medical advice, contact your primary care physician first or use the telemedicine services. Don't run to the emergency room because we don't want people clogging that up. So that is why not everyone should get it, that we want people who have symptoms that are consistent with coronavirus to get it so that they can get the care they need.
Mr. Constantine, we just heard in the last half hour that Tom Douglas is closing 12 of his 13 restaurants because business in the last few weeks since the beginning of this outbreak has been down 90%. When you hear that, and you know that's just one of the many business owners in the county, what is your reaction to that?
Well, I'm very concerned for them. I'm concerned for a lot of small businesses, but the hospitality industry, restaurants, bars, coffee shops, clubs are really suffering already. We are going to be working with them in public health to put in place best practices for sanitation, for discouraging those who are at risk from showing up, for testing their employees to make sure employees aren't infecting others, and many other measures, to be able to really assure that we're reducing the risk of infection in those establishments and increasing people's confidence, justifiably, that they can go there safely. I do want to encourage folks, if they're not already in the habit, to order in from your local eateries to help keep them in business by ordering the dishes you used to enjoy when you went there. I think that in some of these instances, we'll be able to, by real rigorous public health measures, begin to go back to enjoying life in our communities. I read something that really struck me. It said social distancing is not social isolation. We need to find a way to continue to interact, to live our lives, but to do it in a safe way.
We heard from Dr. Lynch at Harborview Medical Center. I said, if you had the ear of our elected officials, what would your statement be? And he said, they need to come see us. They need to come visit us. He said, we need help. What kind of interaction are you having with the hospitals in our community now?
I'm actually in fairly regular communication directly and through our public health folks. In fact, Dr. Lynch invited me to come visit at our public health hospital, Harborview, tomorrow, which I'll attempt to do.
Good.
Talked with our friends at Kaiser Permanente today about the work they're doing, and they have been a great partner, and they're going to continue to help us ramp up the response effort that we have here. This is an all-hands-on-deck effort. It is not just public health. The World Health Organization called for an all-government approach and really an all-community approach, and that's what we are putting together here.
Yeah.
Do you feel like you're getting the help that you need on the federal level, the state level, in every way? All of the resources that you need?
Governor Inslee's been great. The state has been really working hard to figure out how we can align our efforts. The federal government has been a little slow. Clearly, the challenges with the testing are well documented, but we need the PPEs, the personal protection equipment. We need the funding that can back up the work that we're doing here, because we are now borrowing money from ourselves to put about $50 million worth of investments in King County in the short term. That kind of help is critical from the national government if we're going to be able to respond effectively and protect not just ourselves, but the rest of the country.
Dow Constantine, King County Executive, and Dr. Anthony Chen, Director of Health, Tacoma Pierce County Health Department. Thank you so much for being here, you guys.
Thank you.
Really appreciate your
Really
information. So our state senior senator, Democrat Patty Murray, has called on President Trump to issue a disaster declaration in response to the virus.
Earlier today, we interviewed Senator Murray in the U.S. Capitol, and we asked her, how do you rate the federal government's response to the crisis in our state?
I am as angry and frustrated as I can be at the federal government response to the crisis that we are feeling at home. When I talk to a family who has gone to a healthcare clinic really sick and they can't get a test, and I call back to the agencies at Washington, D.C., and they make a false promise about the test being available everywhere, that is misinformation that hurts that family and it hurts everyone around them.
And we asked, what is your office doing to bring federal support to people in the state?
I have done so many things to try and press the CDC and NIH and the other agencies like FDA to get this on the ground. I've been told things that...
Do you support?
We need to target it directly to those people who are being impacted, making sure that they have paid sick leave. So when they're told to stay home because they may be impacted or because they have to care for someone who has coronavirus, they stay home.
So on the Senate floor today, Senator Murray called for a vote on her proposed legislation to provide 14 days of paid sick leave during the outbreak.
Republicans have previously blocked the measure, saying it's too much of a burden on businesses.
We are tracking some new developments that have been coming into the newsroom even since we started this conversation.
And our Greg Copeland is here to break it down. Greg.
So a ton of new changes happening tonight as the virus continues to spread. Here are some of the latest updates that you should know. And we just learned a few moments ago some of the specifics from the Trump administration on the newly announced travel ban from Europe. a lot of people perked up their ears. It has been reported this impacts all travel from Europe, but the Department of Homeland Security says it actually applies to foreign nationals. It does not apply to U.S. citizens or their immediate family members. President Trump also tweeted that it will not affect trade to the U.S. He says the ban starts Friday at midnight. The restrictions will not apply to the United Kingdom either. So a big change there. The NBA is suspending its season after a Utah Jazz player tested positive today. Tonight's game between the Jazz and Oklahoma City Thunder was suspended just before tip-off. NBA leaders say the affected player was not in the arena at the time. A staff member in Senator Maria Cantwell's Washington, D.C. office tested positive tonight. We're told the individual has been in isolation since showing symptoms. Cantwell says she will continue her work remotely. Also, actor Tom Hanks and his wife Rita Wilson tested positive for the virus. The pair are in Australia for the pre-production for a film. Hanks says they are now being closely monitored. Also, New York is canceling its St. Patrick's Day parade. Governor Andrew Cuomo announced that tonight. No word yet on when the parade or whether the parade will be rescheduled. The Seattle Archdiocese is suspending Mass. That is effective immediately. He says he's doing this out of an abundance of caution. Lots of new information coming in. For the latest on the virus, you can text the word virus to 206-448-4545. Mark?
Greg, thank you. Let's get back to our experts now. Dr. John Lynch is the Assistant Medical Director at Harborview Medical Center here in Seattle.
And we're going to get to some more viewer questions in just a moment. But first, you are an expert on infectious diseases, correct?
That's right.
And you work in a hospital setting, and you say it's been so busy over the last 2 weeks. Can you describe to us what a day is like at Harborview since this coronavirus outbreak happened?
Yeah, so, my job is a little bit different than most frontline docs. I have a lot of colleagues who are really working really hard on taking care of patients with this infection and all the other things that we need to be doing. My job is really what's called infection prevention. My job is to prevent infections from happening in the hospital, both to our patients but also our healthcare workers. And really my effort has been working within my hospital but also across UW Medicine around how do we figure out how to respond, how to build those protocols so our clinics and our emergency department and our inpatient units are acting most effectively, being safe, delivering care, and using PPE and monitoring that process.
Let's get to one of our viewer questions. Leonie Valley writes, if many of us in Seattle might already have the virus, what can we expect? Can we still infect people? And how do we know when their COVID-19 journey is done?
Yeah, so again, we're learning a lot. So it's important to remember that most people who get this infection do well, right? Same thing with flu. Most people who get it do well. There are some groups that are much higher risk for progression of disease. Sometimes it's more predictable, older folks with comorbid conditions, heart disease, lung disease. Sometimes it's unpredictable. A younger person gets much sicker. It looks like a lot of other things. And so it's hard to say whether this person has COVID-19 or that one doesn't. And how long it lasts really depends. We learned from the first patient that it took about a couple of weeks for him to kind of build up to the worst part of his disease, his infection, and then it took him about another week or so to get better. And we think that may be sort of the more typical acute course, but we're learning a lot every day.
You did say earlier that it was a little bit different than the flu. We have this question that asks, what is the course of the illness for the average healthy person? And I'm also curious, how does it manifest differently than the flu?
Well, some of the early descriptions of what happened with that first group of 41 people from Wuhan, really the guys who were in the market, they tended to be a little bit older, probably a lot of tobacco use, right? Probably had some other medical problems. And when we looked at them, a lot of them ended up in the hospital. And a lot of them took about a week from the first sort of symptoms to developing pneumonia. And if you recall, the first outbreak was called an outbreak of pneumonia. It wasn't like a virus, it was just, which is kind of strange, pneumonia outbreak. A lot of them got sick, took about a week, which is kind of different. When we think about flu, it often hits us pretty hard, pretty fast.
Yeah.
At the same time, I mentioned earlier, I saw a patient with this a couple weeks ago who looked exactly like someone with flu. Driving home from work, felt fine. Between 3 and 4, all of a sudden, hit her like a ton of bricks. I don't know what this looks like for everyone. I don't know what it's going to look like for folks going forward in our community, but right now I know it looks a lot like things we've seen before.
Yeah. And fever is the common denominator? Is
well,
that right?
A lot of people have fever. Yeah, that seems very common. Unlike the first SARS-CoV-1, if you remember that big outbreak, pretty much everyone with that infection had a fever. And that made it really easy to find out who was infected. We don't think that's true for this. A lot of people are talking about asymptomatic spread, what I call pre-symptomatic spread, infected before you have the disease. We talked about what happens in kids. We're still learning a lot about that. I think what we know is there are people who have this virus who may have really mild symptoms, not have a fever, but maybe spreading it around.
Yeah. What worries you most about the virus?
Well, I have a bias here. So what I'm worried about the most are the folks who are at highest risk. These older folks. It is really a disaster what's happened with our community, with people suffering and dying. This wouldn't have happened. You go back 6 months ago, this wasn't going to happen to these people. Now it is because of the presence of this virus. That is the real tragedy of this. Deep down, what it occupies me every day is how do we keep our hospitals functioning? I am deeply concerned about that, and we need to be thinking hard about how to respond so that we can ultimately take care of those people most at risk.
I was looking at this map earlier today of the cases across the United States. I think all but 8 or 9 states are reporting at least one, some multiple cases in the United States now. When we were the one, 10 days ago that had the first case, I can't remember, was it 50 days ago? I can't remember.
It feels like about 6
but
months ago.
But we've gone from being the first state to now almost all of the states. And when I look at the numbers, when they say we were sort of on par with where Italy was at about the same time, and just in the last 24 hours, they reported 2,300 new cases. Do you think we're at that trajectory?
Well, I saw an excellent interview with a very well-known sort of scientist who looks at all these things, and I appreciate what he said is that we can say, well, this is what could happen, and I think that we could have a trajectory like Italy, but we don't have to have a trajectory like that. We can be on the same arc, but if we take the actions that we need to take now, we can affect that. We can flatten that curve that you showed earlier. What we just don't want to see is a great big spike of cases that overwhelm our hospitals and our society. So how do we spread that out? We may have the same number of cases, but we'll be able to handle it and to absorb it. And so that's a possibility that we see a big spike, but we still have time to do something about it.
Yeah, you mentioned that most people who get this, we've been hearing about 80%, have very mild symptoms. Do you hope that this sort of wake-up call gets us all to really refocus on what we can do for the next one? Because there will be one, right?
It's really important for people like me to get outside and actually talk to people. Unfortunately, I haven't done that for a couple of weeks. I need to go to the grocery store and do other things where I'm talking to colleagues or friends because I think that there does appear to be a disconnect when I talk to people who are out there. I was actually on an elevator recently with a surgeon who said, I thought this was over. Right? And he was honest and sincere. This is someone who's a smart person. And I think we need to do a better job of really informing people how desperate the situation is. Particularly, the thing is it's impacting specific populations really, really hard right now. And a lot of times those populations aren't visible to us. We don't see what's happening in a skilled nursing facility. We don't see what's happening in our ICUs and our emergency departments when we're out and healthy. So I do think that our folks out there who are well, who have the ability to act, do need to listen to our public health leaders and really take time, make that action now.
We've been working really, really hard here at King from the very beginning to provide context, to give people the facts as we know them, but to also be real about the urgency of the situation. So what would you say we could do to better serve our public so that we are giving them the information, the facts that they know, so that we are all well armed to be safe and healthy?
Well, that's why I'm here right now. I mean, I think the journalist community here in Seattle is fantastic, and I really appreciate you guys doing this. This is important to give the message to our community, the right facts. We live in a world of disinformation in many different fora, and I think opportunities like this to ask questions, to have people on the air from public health, from leadership, from our government, from infectious diseases and primary care are really, really important. I'd ask people to go and look at reputable sources. I think our sort of mainstream folks, New York Times, the King 5, Como, Cairo, everyone is really trying to do a good job. And I think we should really be looking to them. Look at our CDC and Department of Health and Public Health King County. The Public Health Insider blog for Public Health King County is a wonderful source. Dr. Duchin and others put a lot of information that I think is really, really worthwhile. So panic's not our friend, but planning is, and planning really helps keep us safe and also helps kind of deal with that anxiety and fear that some people may be feeling.
But being mindful of the facts as we know them so that we can be well armed.
It is really important. This is a virus. like a lot of other viruses. We know what to do. Dr. Chen mentioned it before. Public health knows what to do. Doctors know what to do with this. We got to demystify it. It's not some other thing. We can do this. We just have to respond in the best possible way.
Yeah. The next one could be much worse. I mean, have there been case studies done or projections done of what could happen if we get a really, really serious viral outbreak?
Well, if you look at the WHO and CDC, what everyone is most worried about when thinking about emerging infectious diseases, which seems to be happening at a faster and faster pace, right? You go back 30 years, people weren't talking about brand new viruses, and now we've had SARS, MERS, right? The reemergence of Ebola, SARS-2, H1N1, avian influenza, right? The list goes on and on. Those all come out of animal populations, these zoonotic infections, and it's definitely a deep concern. I'd say most public health authorities are looking at new types of influenza coming out and are preparing for that. I think that preparation is serving us well to some extent now, but I would say that we don't know what's going to be next.
Dr. Lynch, thank you so very much for the time that you've devoted today. We know that you are so busy, but we really appreciate it. I know our viewers do too.
Appreciate having me on. Thank you.
Thank you very much.
We want to share one more bit of misinformation spreading online about the coronavirus. There's a chart comparing COVID-19 to other viruses like SARS and Ebola.
So that chart has people asking, is COVID-19 more infectious than other viruses? We sent our Verify team to check it out.
A viral video clip comparing the current coronavirus strain to viruses like SARS, MERS, Ebola, and the swine flu seems to show the coronavirus is way worse. It starts all the viruses at day 1, and the lines go up as more people are infected. Around day 20, SARS is way above the rest, about 1,500 infected. But then, in the next 20 days, the coronavirus takes off, all the way to 43,000 infected on day 42. This is frightening, especially without context. We think of SARS and swine flu as being bad, but a glance at this would make the coronavirus appear far more severe. So is it true? We're verifying. Our sources, the CDC and the WHO, along with a few scientific studies. First off, the numbers are accurate. WHO numbers do show about 43,000 people were infected on February 11th, which is 42 days after they first started counting. We're now much higher, by the way, past 80,000 worldwide. We also checked the numbers for SARS, MERS, swine flu, and Ebola. These charts accurately reflect the data from the CDC and WHO. What does that mean? Simply, the chart is accurate. The current coronavirus is infecting more people at a faster rate than any of those other viruses. But this video is missing important context. We tracked down the original source, a 10-minute YouTube video, not a 40-second clip. If you play beyond the viral clip, you'll see that as you get into the hundreds of days, swine flu takes over and eventually gets up to 60 million infected worldwide. This video was actually trying to show that coronavirus isn't the worst, at least not yet. Bottom line, we can verify this video is true. The numbers are accurate and come from reputable sources, but the video doesn't show the whole story, and that context is key. For instance, this chart shows how infectious these viruses are, not how fatal. The coronavirus is the most infectious at this point, but it has the second lowest fatality rate. Only the swine flu had a lower rate, while SARS, MERS, and Ebola were much more deadly. Giving more context may take more time than a 40-second viral clip, but it can help make sure that we're focusing on facts, not fear.
So we are still getting your questions that you've been texting to us or you've been sending them on Facebook, and we want to remind you we still have doctors and experts standing by. They will answer every single one.
We also have extensive coverage on our website. We can send you a link. It's the same number that you've been texting your questions that you can get that link. Just text the word virus to 206-448-4545. We will send you a link to all that great information. Also, huge thank you to all of our guests who spent the evening here at King 5 sharing important information and facts, not fear. We've had a range of leaders from city, county, state leaders as well, from the
from Mayor Durkin to our county executive, Doug Constantine, Dr. Lynch, Dr. Chen, and so many others, Dr. Giamoli. I think I have that right. Anyway, so many wonderful people, and your questions have helped to make this show what it is, to provide the information that we hope is going to help you and your family stay safe.
Yeah, we hear from a lot of you, and we welcome those thoughts. Sometimes you like what you see on TV, sometimes you don't. The interaction that we have with you is so important as a journalistic operation that we have. Keep your comments coming, keep the thoughts coming.
So thanks for joining us. Again, there's been a lot that's happened today regarding the coronavirus with what the governor has said, also with what the president has said to the nation today. That's all coming up on King 5.